All right, we'll go ahead and get started. Hi, everyone. I'm Lauren Goldstein. I'm the Assistant Dean for Research at the School of Public Health. Welcome to the latest in Public Health Research series. We are really fortunate today to have with us Dr. Tomás Aragón, who is an adjunct faculty at the school and also an Impact Fellow this year. He's also a strategic advisor to Trust.care. Dr. Aragón served as in government public health for 29 years, including as state public health officer and director of the California Department of Public Health. So we're really fortunate to have you here today, Dr. Aragón. Thank you so much for your time. He's going to be talking today about decision intelligence for health, public health decision making under constraints. And really excited to hear from you. Thanks so much.
Okay, thank you, Lauren. I put in the chat, I put a link to a not the presentation, but just because we have a heat wave. It's extreme heat health effects. It's something I put together a couple of years ago when I was at CDPH, but it's a good way to think through all the ways you can get in trouble with heat waves. And when you get exposed, when you're in heat and you get exposed, you have to make decisions. So this helps you think about all the ways that things can go wrong in a heat wave. The people who actually get in trouble are actually younger people. People think it's older. It's actually the younger people who go out there and exert themselves and get in trouble. Okay, I'm going to talk about the decision making. I'm going to go relatively fast. Let me make sure I get this correct here. Hang on for 1 second here. I'm going to stop for a second. We gotta put the right thing up. I hope everybody's staying cool today. Okay. Here we go. Okay, so most of what I'm going to say you can find on my website, which is teampublichealth.substack.com. And I also have a separate site that focuses on decision modeling, focusing on doing coding for simple decisions. And that's more of an educational site for people who want to learn how to do decision modeling. And I'll talk a little bit about that, hopefully near the end. I want to just start with the overall framework. So this is the way that I put together how to think about decision making. And I start off at the top with the rationale and urgency. And it's important for us to recognize that decision making is the most important activity that we do every single day. But we're not trained on how to be good decision makers. And I notice that sometimes people resist becoming better decision makers. So hopefully by the end, you'll have a few tools, you have a few ways of thinking about it, and you'll have a learning path. So you will continue to learn. And this is the learning path that I think you could use. One is there's 4 dimensions. Decision quality, what goes into a good decision? You should have a checklist. I'm going to give you a checklist. Decisions occur within strategy execution frameworks. And I'll mention a few. In public health, we use things like the incidence command system, or if you're using lean, there's different frameworks. You always want to get better. And of course, you want to leverage ethics, science, and technology. There's 4 competency domains. This comes from the Alliance for Decision Education. They're a phenomenal organization. Daniel Kahneman, before he passed away, was on their board, and there's a lot of, he had a big influence in helping that foundation. So recognizing and resisting cognitive biases, valuing and applying rationality, thinking probabilistically, and structuring decisions. Then we have 4 constraints that I want people to be aware of: information, values, times, and resources. And then if we take those 4 constraints, we can look at 4 prototypical decisions that public health officials face. Public health officials, because of where they live in their decision-making space, their learning is actually applicable in any other sector. So decision-making under uncertainty, ethical decision-making, emergency and crisis decision-making, and then priority setting and resource allocation. The constraints can happen all together across all 4 of those. But for the purposes of learning, I paired up the constraints with the 4 deep decision challenges. Okay, so that's the background. And what I'm going to do now is I'm going to go up. I'm going to go up. I'm going to look down on this field from a traditional perspective, and then we're going to come back at the end and sort of weave this all together. So I've always been interested in decision making, and the big decision that I participated in is when we did our shelter-in-place orders in the Bay Area. We were the first area in the United States to do the shelter-in-place order. It was really a series of decisions. It wasn't just one big decision. It was a series of decisions, and we had reached the point where what are we going to do now? We're doing everything we doing everything that we know, and we have outbreaks occurring primarily at that time in China and also in Italy. We were looking at the numbers and seeing what some of the modelers were saying, and so we knew that if we didn't act soon, that we would have an explosion of cases. So I'm going to come back to the end. At the end I'm going to come back to this, and hopefully you'll see a lot of the elements of what I think was good about making these decisions. But there's a lot of challenges, and many health officials had to make these decisions. And let me preface this by saying the health officials don't make the final decision. We make recommendations to our elected officials. We give them options. We try to incorporate science. So the first thing I want you to remember is this. There are only two things that determine how your life turns out. Luck, those things that are outside your control, and the quality of your decisions. You have control over only one of those two things. This is why decision making is so important. Your decision making is the single most important thing you have control over that will help you achieve your goals. A nice overall framework is from this book called Handbook of Decision Analysis in its second edition, and it's influenced by decision scientists that have been working in this area for a long time. And the two axes there are analytic complexity and organizational complexity, and they have a lot of good items to think about when you're facing decision making. I want you to notice that there's 5 ovals in that graph. The first one is automatic. That automatic is, think about how we make decisions every single day, many of them almost unconsciously. And that is what Daniel Kahneman calls system 1 decision making. Quick, sometimes emotional, very automatic. And then there's that which requires more cognitive effort, and that's in the blue, and he would call that system 2. And so this is a good learning path, is that you want to learn about how do we normally make decisions, how do we get ourselves in trouble. Look up to the second part there of the graph. Be sure take workshops on facilitation. Learn how to learn groups of people through difficult situations. Have a checklist, which I'll give you. I'll mention decision analysis. I'm not going to go into it, but the decision modeling site has examples. And then there's up there what they call the dialogue decision process. And this is when you're making really complex decisions. And I'll show you, I will show you how, for example, the CDC ACIP, their dialogue decision process, which was called evidence to recommendations. So you see that when you're dealing with these complex outcomes, you bring in diverse group of stakeholders to help make decisions or recommendations. Okay, our first task is to learn from the past. So we have to look back, and one of the problems is that when we look back, our cognitive biases make it very difficult for us to learn from old decisions, from prior decisions. So you want to look back and think about what cognitive biases prevent you from learning from your prior decisions so that you can take those learnings and move forward and make good decisions for the future. So I'm going to take you through a classic example that's used many times to make this point. So this is Super Bowl 49 in 2015. I remember watching this. There was like 26 seconds left. This was the end of the Super Bowl. The Seattle Seahawks have the ball on the 2nd-yard line. The New England Patriots want to prevent them. Basically, if they score, game over. Seattle wins a second Super Bowl. And so what happened was is that everybody was expecting Marshawn Lynch to get the ball and run into um, and score a touchdown. But what happened was is that Russell Wilson attempted a pass, and in the last second, it was intercepted by the New England Patriots. The New England Patriots went on to win the game. So the question was is that why did Pete Carroll, the coach of Seattle, make that decision? And so here are the criticisms after the game. USA Today, what on earth was Seattle thinking with worst play call in NFL history? Worst play call in Super Bowl history will forever alter perception of Seahawks and Patriots. Dumbest call in Super Bowl history could be the beginning of the end for the Seattle Seahawks. Seattle Seahawks lost because of the worst call in Super Bowl history, etc., etc., etc. This is what's called outcome bias, or also called resulting. All of us do it. We tend to judge a decision by its outcome. If there's a bad outcome, we think it's a stupid decision. And sometimes we think they're stupid people who are doing this. This is why they had the bad outcome. We see it all the time. And I want you to be aware about it because you can see it almost daily, especially if you're reading the media. Here's an example. This is Kamala Harris in her book that came out. I think it was reckless. Quote, in retrospect, Kamala Harris writes of letting Joe and Jill Biden decide on their own whether the then president should have tried to run for re-election. I think it was reckless. It's Joe and Jill's decision. We all said that like a mantra, as if we had been hypnotized. Harris writes in the first excerpts of 107 Days published on Wednesday in The Atlantic, the stakes were simply too high. This wasn't a choice that should have been left to an individual's ego and an individual's ambition. It should have been more than a personal decision. This is called resulting or outcome bias, and we all do it. That's the important thing to do it. That's the one thing to recognize, is that we all do resulting. And this prevents us from learning from our decisions. Rather, we should be asking, was it a good decision? Was it a good decision process? And oftentimes we don't know what the process is because most people are not trained on how to make decisions. So they can't even explain to you how they made the decision. And this happens with big stakes. And you're seeing this right now with what's happening with the current administration, that we have ideas of how decisions were made. And at least what the newspapers are reporting, it was based primarily on intuition. So these stakes are high, and it's important for us to know that. So I mentioned the left-hand side here, resulting or outcome bias. We judge ourselves and we judge others differently based on the outcome of the decision. So we want to avoid that, and we want to be aware of that. Also, there you see hindsight bias. When you look back, the outcome that happened feels probabilistically different depending on the outcome. It was foreseeable. It was inevitable. We have a distortion of our memory at that time. So what you want to do is you want to focus on having a good decision process, and then you won't have regret. Okay. So I'm going to say a few words about facilitating decisions. So one of the things that I think about is why are people resistant to learning how to make better decisions? One of the reasons is that decisions are complicated, but another one is that people don't want to slow down. If you're very action oriented, you want to act, 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 act. And this is how a lot of people are in organizations and environments where you are rewarded for just being action oriented. Okay. And I understand that. That's okay. That's fine. That's fine. You want to have a mindset, a mindfulness to recognize when do I need to slow down, pause, and do a better process. So when there's high stakes, high costs, high impact, high emotions, you want to pause and say, there's a better way. We can't just rush. We can't just rush into this. And oftentimes the way these decisions are made is the way other decisions are made. So it's based on organizational culture and organizational norms. And so you can see this happening in the organizations across the country. So it's a lost opportunity to improve decision quality when you don't do that. What you want to do is, you see there on the left-hand side, business as usual. You want to say, oh, nope, we're gonna stop. We're gonna think about how we're gonna make a better decision. We want to have good information. We want to have the right people in the room. We want to take them through a process of creating good decision options, good alternatives, and then we want to have a reasonable process of converging to an answer that we can all move forward with commitment. So you want to go through this kind of process. The challenge is that this kind of process takes time, and it also requires cognitive effort. It requires cognitive effort on the front end, and it requires cognitive effort in the middle when you have to deal with people's emotions, and it requires cognitive effort on the right-hand side when you have to narrow down your options. So this is where artificial intelligence is going to help us, because um, there's ways of us sampling information that's going to reduce some of the cognitive load in getting information and processing it and making it available to us so we can spend more time on the people aspects of decision making. So this diagram was adapted from a book called Facilitator's Guide to Participatory Decision Making. They are coming out with their 4th edition this year, and they provide excellent workshops. I just participated in their workshop last year. They're based in San Francisco, but they also do workshops in Southern California. So it's called Community at Work. They've been doing this for over 30 years. They're an amazing team. So if you want to learn how to just focus on the facilitation component, the people component of it, it's a great resource. Some existing frameworks have this kind of thinking baked in to the way that they do their framework. An example of that is design thinking. So design thinking, it is designed to go through this divergence and convergence process, to involve key stakeholders, to be very human centered, and to collect good data, and then to prototype and test. So if you're already working with that kind of framework, you're doing pretty good. You want to take that kind of mindset and know when to apply it. So design thinking is a good way to learn this process with people, with a group of people. Then we have our cognitive biases. I'm only going to mention a few. This is a great book. It's called "So You're About to Make a Terrible Mistake: How Biases Distort Decision Making." I want to just start with I'm going to just mention a couple. One is confirmation bias. We tend to pursue information that just reinforces our own biases that we're not even aware of. Attribution error, I mentioned that we judge people, we judge ourselves, and we judge people differently based on the outcomes. That was an example of hindsight bias. If you go over to inertia biases, you see escalation of commitment and sunk cost fallacy. This is so classic. It affects all of us. Is that we've been working so hard on a problem. We don't want to quit because we've invested so much time, energy, money, and sweat. And so you continue to do things. And you see this happening at the national level, where leaders get countries into wars and then do not get countries into war. They escalate. And so these two go together: sunk cost fallacy and escalation of escalation of commitment. Under social biases, you see things like groupthink and information cascades. Information cascades is that the first topic that's brought up in the meeting is the topic that ends up getting discussed, gets more time, and that may not be the best way to do team business. Okay, so I want to for a moment here just give you this slide. So when I train health officials, I say to them, if you don't remember anything else from this talk, just remember this slide. Just remember this slide. So this is a simple 3-step process that I use with my adult children. Okay, so when my children come to me and they say, Papi, I'm struggling with a decision, I just do step 1. What are your values? What are your goals? And what decisions will likely lead to outcomes that will move you closer to your goals? Okay, you get a lot of mileage out of those 3 questions. Tuck those away, print this out, use it all the time. You get a lot of mileage. If you have more time, do step 2. What are the worst outcomes and how are you going to avoid them? That's called a pre-mortem. What are the best outcomes and how are you going to achieve them? That's called backcasting. Pre-mortems and backcasting are really important. We tend to be optimistic. We tend to focus on question 2. The pre-mortem puts you on the other end of the spectrum. So you want to have a solution space. You want to have a wide solution space. So this widens your solution space by doing a pre-mortem and doing backcasting. And then what new behaviors and activities do we need to start? And what old behaviors and activities do we need to stop? It's really important to talk about what you're going to take off the table because you only have so much bandwidth. And so there's an opportunity cost, and the sunk cost bias is what keeps us in number 4 and not stopping things. And of course, number 3 is how are you going to manage the psychological processes impacting teams and individuals, things like psychological safety, their cognitive biases, emotion, groupthink, so that we can make good decisions that stick and improve. So this is the one slide I want all of you to tuck away and remember. And this is just a visual example of that same slide. I got this idea from a psychologist that teaches people how to break bad habits. I'm not going to go over the slide. It's the same content. It's just visually presented. And there's a great book. There's a blog entry on this if you want to go into detail. I want to quickly give you a personal story. And decision making, people think decision making is only when you're making obviously important decisions at work, sometimes in your personal life, but sometimes these things happen quickly when you least expect it. So you're more likely to make better decisions when you're mindful, you're in the present, you're well rested, and you can think sharp on your feet. This is just true. This is why it's really important to just take care of your mental, emotional, physical, and social health because it puts you in the mindset to be able to make better decisions. So we went to Crater Lake in June of 2025. We were planning to do all this hiking. Unfortunately, the weather did not agree with us. The Crater Lake is in Oregon, and it's in a high altitude, and it started snowing. It had not snowed there in a long time. Basically, all the roads were closed. So we were for several days we were stuck, and we really wanted to go out and do some hiking. So it calmed down a little bit. It snowed all night. It had snowed all night. So we went. We heard that there was this path near the hotel. So we went along. We started climbing this path, and we heard if we get to the very top, that we can have this amazing view. But we heard that something had been closed down. We didn't know much. So we started going up this path, and it was we can tell where people had gone on this path because you see all the footsteps, and you can see deer. So on the left-hand side there, you see a deer on the slope there. And then all of a sudden we got to a place where basically the path stopped. and we thought, oh, this is weird. We know we thought we were about 2/3 up. So we did see some footsteps going forward. That's my son there on the right-hand side. You can't see this, but to the right of my son is basically a cliff, a fall off. But as I looked at that path, I thought to myself, okay, if we go on this and we slip, there's enough space that we're not going over the ledge. So I felt good about that. Okay, we're not going to go over the ledge. And then I did a quick pre-mortem. I said, what's the worst thing that can happen? And because I was mindful and rested, and I thought, ooh, I then looked up and I saw all this packs of snow. And I thought, the deer, you have animals running. I say, if there was an avalanche, it would not, if we were on that path, if there was an avalanche, it would not take much snow to just push us beyond that ledge and basically take us over the cliff, and we would die. We would die. So we decided that at that moment that we would not cross that. And we turned around and we went home. And so we did a pre-mortem. We made a decision, and that really impacted our decision. I'm trying to make one point I want to make is that decision making, these tools are incredibly useful that you can use in the moment. You will find yourself in situations where you have to think quickly on your feet. And if you go through these questions really quickly with a team of people, what's the worst thing that can happen? How do we prevent that from happening? You can make pretty quick decisions that are more likely to have a better outcome by taking these types of approaches. So it's real, and it makes a difference. Okay, decision quality requirements. So now, if you wanted to get a little bit more, get into more detail, these are the 6 elements of good decision making. Of decision quality, this was put together by decision scientists who worked on this for many years, and primarily the person that I was influenced by is Ron Howard, who basically one of the people that really popularized decision analysis starting back in the 60s. What are we really trying to decide? That's your frame. What do we need? What do we need or want? That is, what are the consequences that we care about? That's under this idea of values. What alternatives do we have? When you go through the process of doing a pre-mortem, you expand your alternative solutions. What do we need to know? Information processing. Are we thinking state reasoning, and are we committed to do this? So these are the things. This is the checklist. And there's a lot of things to learn how to do this well, but this is a big start by just having the checklist or using the other one with the other 3 questions. It helps you tremendously. And then as you learn new tools, you can begin to add it to this framework. Okay, I'm gonna mention a few things. So when you're doing decisions, sometimes you have a single outcome that you're trying to optimize. In business, it's what's called net present value. You have a cost and revenues coming into your organization into your business over time, and you want to calculate the net present value. Okay, so it's relatively, when you have a single attribute like that you're trying to calculating expected values, it's a process that's easy to do computationally. In public health, usually we're trying to optimize the health outcome, and it might be, for example, just the rate that we're vaccinating people, the cases of vaccine preventable diseases, hospitalizations, and deaths. So we tend to focus on these effectiveness outcomes, and sometimes we'll look at cost as inputs, and we'll do cost effectiveness studies. Okay, so that's great, and everybody should learn how to do some real simple decision analysis, and I'll show you examples of how you can think about it. Then there's multi-attribute, is that yes, those outcomes are important, but people are interested in other things besides those outcomes. They're also interested in vaccine I'm using vaccines as an example just because it's a good one to think about. People are interested in vaccine adverse events. They're interested in the preventable disease outcomes, but they're also interested in equity, acceptability, feasibility, other outcomes, and it's hard in a reasonable amount of time to translate that into a metric that makes it easily comparable. So this does get messy. And so you still have to tackle this. And the way that's usually tackled is through a process I'm going to show you in a second. But I want you to, we're going to take the single attribute example, and I'm going to show you how to think about it in a 2x2 table. So this is a two-way table, and you have a decision. This decision has three choices. You can only do one of those. So that's your alternatives. Those decisions have consequences, and think of that as your metrics. And sometimes you can model those outcomes. And then you want those consequences, those outcomes to contribute, to take you towards your objectives or your goals. So this is called a consequence table. Everybody can do a consequence table. My wife, who was a first grade teacher for 30 years, she does consequence tables because they're easy to do. You just write down, what are my goals? What are my options? And what consequences are going to come from those options? Think of those as measures that are going to contribute towards my goals. So some people will look at those goals and think of those as decision criteria. So anybody can do this, and if you practice, I promise you'll get better at this. So here's a simple example from epidemiology. You have your improved outcomes, yes, no, and you have alternative A1, A2. You can calculate proportions, and you can compare those proportions. So basically, it's basic analysis of a two-way table. So that's what a consequence table is. And if you think about this carefully, you realize that this could be converted into a decision tree, and you can actually use decision analysis. So for the epi people in the audience, is to recognize that these simple, especially with these single attributes, these consequence tables, which are just two-way analyses, can be converted into decision trees. And then that opens up more possibilities of how you begin to think about this. But you can master the basics. Here's an example with measles infection and vaccinated versus unvaccinated. And you can calculate the vaccine effectiveness. That's the key result. But anyway, this could be also done as a decision tree. Here's an example of a multi-attribute where I have measles cases, measles hospitalizations, and measles death. So those are different outcomes. They have their hospitalizations and cases are going to impact quality of life, and deaths, of course, is the ultimate impact on quality of life. Doing this it requires more effort because it's just you have these outcomes that are multi-attribute. It's not like a single measure that you can easily summarize. And then at the bottom there, I could have included vaccine severe adverse events, but the numbers are basically 0. And so no matter how you look at measles infection, measles, everyone should be vaccinated. If you look at this in a very objective way, you realize getting vaccinated is the best strategy. So I showed you decision alternatives across the top. We can look at for one decision. You could only choose one for one decision. Well, you can have multiple decisions, each of which have several options. So what you have is I can do everything, one from each one. That's strategy A. I'm sorry, not do anything from not do from any of them. So that's strategy A. To do something from all of them. Let's say option 2 from D1, option 2 from D2, etc. And that's strategy B. This is called a strategy table or a policy table. So this allows you to look at more complicated decisions. You can look at the cost, and then of course you have the consequences. And if the consequences are single attribute, then it really facilitates modeling. But if it doesn't, you still have to deal with it. It's more complicated, but it means that you have to usually bring people together. Although you can model the outcomes separately, but it's hard to bring it together into one summary measure. So this is a strategy table. So we can take the strategies now and put it into a consequence table and get back to that same concept. I need to pick a strategy. Each one of those strategy represents different options. So the example that I'm going to show you really quickly is, so this was when I was in San Francisco, and we had a problem with syringe litter. Syringe litter was so bad that the Board of Supervisors were thinking of closing down our syringe access program. So syringe access program is SAP. Syringe disposal and recovery is SDR. Those are in the squares. Safe injection services is SIS, and then occupational safety and health, because you have people out there in public works who are picking up all these syringes. NS is the number of syringes, DS is number of discarded syringes, and then here you have prevalence of infection, HIV, hepatitis B, hepatitis C, contact rate, and then let's see here, and then the transmission probability, which is QI. So basically, you have options 1, 2, 3, and 4. You can do none of them, or you can do some combination of those 4, and that would go into a strategy table. And the outcome here is transmission. So modelers can actually look at what we know about the transmission of needle stick injuries, which there's a lot of data. So this is actually relatively easy to model. And so we modeled it in a really simple way to basically show that the best strategy long term is to do all of these because it decreases the prevalence of infection in the community so that less contaminated syringes are available if somebody gets stuck. So this example, that's sort of a concrete example of a strategy table. There's different ways of formulating these examples. I'm not going to go through these other than to tell you, go to the website and you can learn a little bit about how to model these two. At the website here, we have, we'll take a specific example and we show you how to do it with a decision tree, an influence diagram, and then agent-based modeling. So the same example. And we're using R, Python, and Julia as the 3 coding languages. And actually, this is where AI is really cool because AI can help you with your modeling. For example, if you're learning Python. Okay, quickly through the decision dialogue process. Okay, so I mentioned that when things get complicated, you have these multiple outcomes. The decision dialogue process that is used in public health is called the evidence to decision framework or the evidence to recommendation framework, which ACIP uses. If you go to that PDF file, you can download their 60-page document, and it shows this is how they train the people who participate in ACIP, used to participate in ACIP, because RFK Jr. decided to dismiss most of basically everybody. And basically they're not doing this anymore. But this is just an infographic of that process. You see there the criteria, and there's a lot of discussion and taking people and making judgments across all these different outcomes. Okay, so we're going to wrap up. So I took you through a high-level view of components of this, and I'm going to, in the last few minutes, I'm going to make sure. I want to make sure I leave a few minutes at the end for questions. I'm going to just go through 1.5 examples. When you go to my site, you will see these infographics to help you think about that. There's a lot of tools there. I do want to call out something there under reasoning. So every decision that you make requires a causal assumption, requires prediction, and has an opportunity cost. So this is especially for public health students, is to recognize decision-making is a great integrator. It forces you to integrate the different disciplines that you're learning. So this is why I tell students, make sure you learn causal inference really well. Really try to master your statistics and probability theory. And then if you have a chance, take health economics, understand what opportunity costs are. Decision-making is a great integrator. It helps you recognize why these courses are so important. Okay, this is just the chain in a different format, organized as a PDSA. The other thing I want you to recognize is that when you're dealing with information, this is the famous, I think they call it the Rumsfeld matrix, which is you know what you know, you know what you don't know. You don't always have time to go get it, so you have to get it from somebody, including it may be an AI agent that gets it, and then you know there are things that you don't know but you cannot get. That's called deep uncertainty. And then the bottom row are the things that you are not aware of. So there are things that are known that you're not aware of that you should know, and that's a blind spot. So you want to get feedback. So this idea here of information is really important, because here where feedback is important, stakeholders who are in the room are important, and in the face of time constraints, the best way to do, oftentimes there's not data available to you. You don't have data, or you don't have capability of crunching the numbers in the moment to give you what you want. So you still have to sample data. The data that you start with is sampling the data of the people who are sitting around the table. Everybody has information and expertise, wisdom and knowledge in their brains. You want to sample that information, get it out there. And so that's part of becoming, I think, being a good leadership skill, is that how do you create the psychological safety and the facilitation processes so you can sample the data in people's brains and make sure you have the right people at the table. Okay, so this is a different way of thinking about data-driven decision making. Start with the data in people's brains. Ethical decision making, not going to have time to talk about that. I did a Substack posting on this. Incredibly, incredibly important. It's so important. We're making ethical decisions more than we realize, and we see that happening at the national level. Okay, I'm gonna just show you one thing because I want to leave time for questions. So we wrote a paper on our decision making for the COVID shelter-in-place order. I mentioned to you that decision quality is important. So this is the decision chain in a different format, and that decisions occur within frameworks. So the framework that I used during the COVID pandemic was exactly this framework, and I call it PDSA problem solving. Okay, because we had to select the problem, we had to recognize its consequences. The consequences help you prioritize your problems. You have to look at underlying causes, and then you have to develop countermeasures to do that. And that's basically what we did with COVID. And I had a piece of paper that I wrote out everything, and that was sort of my playbook on how I managed COVID. And to recognize that each one of them is a series of decisions. You're choosing what problems, you're choosing how to do the causal analysis, you're choosing countermeasures. So all of them involve choices, okay? Including the choices of who's going to be on your team helping you make these analyses and then come with these decisions. So it's recognizing that there's an opportunity to improve the quality of these different steps. It's really important. You want people thinking this way. Okay, I'm gonna skip this because you can read the paper and you can get a lot out of it. This is a consequence table that's in the paper. This is a strategy table that's in the supplementary thing, but it shows you different strategy options from do nothing all the way to do everything. And you see there's shelter in place, face masks, physical distancing, hygiene, etc. Hygiene, disinfection. Another checklist to help you not get in trouble politically. You'll see down there at the bottom, public trust, political support, legal issues, logistical issues. This is the starter pack. Everyone should read these 3 books in this order. They're all fantastic. They're all fantastic books. Annie Duke's, she'll really make you strong in the cognitive psychological stuff. Michael Roberto goes through all these big catastrophes that happened in American history and the decisions people made. And if you read Michael Roberto's book, you will not be surprised by all the craziness that you see, because you'll realize that we, as humans, we make horrible decisions. And then decision quality introduces you to basic decision analysis. And then this is if you want to take it to the next level, these are books that you can start consuming. Okay, I'm going to end there because I covered a lot of material and we have a little time for questions, and I hope that I piqued people's interest.
Fantastic. Thank you so much, Tomás. That was fantastic. Yes, please, people can either put questions in the chat or you can unmute and ask a question. Lots to think about. It's really an amazing framework that can be applied to so many things.
While we're waiting for somebody, does anybody know of a good course at Berkeley that teaches decision making?
Good question. I do not. Does anybody know?
If you do, please share it, because I am interested in other professors that are tackling this.
And how did you get interested, or did you teach yourself about all of the decision-making field, or how did you get interested in it?
I became interested in it actually in medical school. In medical school, so I took a course on decision analysis, and this was in the mid 80s, and I learned all this, how to do decision analysis with medical decisions. And so that actually just helped me tremendously when I did my residency, because that's the mindset I brought. So you saw a lot of that. You see a lot of it show up in the academic literature. So you see a lot of cost effectiveness studies, Markov modeling. You see how it impacts ACIP. But what hasn't happened is a translation into everyday practice, which is really more about team dynamics and cognitive psychology. And it's a lot of the soft skills. So it's really the bringing together of that, and that's what I'm really promoting. We do have a lot of computational things that are really interesting, which I enjoy as well. But you actually get more mileage from the soft skills, the people skills.
Right. And Jessica says there's an MPH health policy decision-making course that she hasn't taken yet, but she hears that students like it. So
Oh,
great.
fantastic! Yes,
Great.
take these courses, take causal inference, and to
Public health.
learn as much as you can.
Public Health 220. Great. Thanks. Thank you. Great. Any other questions? Well, I will be sharing the slides, and people can also reach out directly, I'm sure, if they have questions to Dr. Aragon. And thank you so much for your time today. We really appreciate you sharing your expertise and all the insights and links. So thank you so much. Really appreciate your time.
Okay, everyone, be safe
Okay.
and
Yeah,
stay cool.
stay cool today and drink lots of water. All right, take care. Thanks so much. Have a great day, everyone.